Lori, great question. Lori Zold, yes. Lori Zold asked a great question that I wanted to answer and I forgot to. Lori said, what's my recommendation for setting a good goal weight? I really recommend looking at your BMI. If you Google what is my BMI and you put in your weight and your height, you will see where you fall in a range and what a healthy weight range would look like for your height. A lot of people online like to bash the BMI. I don't know why. It's scientifically based. It's been used by every medical professional and doctor for years, at least within the American system. I've worked in hospitals. The first thing when a patient comes in, we have to know their BMI. As a dietitian, as a doctor, everyone sees it. It's on your health chart. If you're a bodybuilder like Arnold Schwarzenegger in his prime, the BMI is not going to be fully accurate because he had an obscene amount of muscle mass. But for an everyday person who works out maybe 30 minutes to an hour a day, but looks generally, not uber muscle mass, it's a pretty good indicator of finding a healthy range for you. And so it's a quick, easy calculation. Could Google, what's my BMI, figure out where you are. If your BMI is 35, a healthy range is considered 18.5 to about 25. If your BMI is 28, see what your weight would be like at 25 to get you into that healthy weight range. The BMI has been proven to be a really good indicator of serious chronic disease risks. So as you're in a BMI if your BMI is obese, the risk of heart disease is higher than if your BMI is overweight. So there is a lot of good research and understanding to it, and it is a nice reference point for figuring out a healthy weight for yourself. Of course, you can be healthy and well with an overweight BMI, but it is a good reference point if you don't know what a goal weight would look like for you. How long will it take to lose 100 pounds? Kayla is asking, how long will it take to lose 100 pounds? The more you put into this, the more you're going to get out. So, I've seen in the test groups, people who have more, like a woman who has 100 pounds to lose and a woman who has 20 pounds to lose. And you would think that it would be easier for the woman who has 100 pounds to lose and harder for the woman who only has 20 pounds to lose. But if the woman who only has 20 pounds to lose has amazing motivation and really does this and has a really positive mindset, she can lose those 20 pounds faster than the more overweight person can lose their 20 pounds. So it really comes down to mindset, not metabolism. I've said it 100 times because I've taught big groups of weight loss seminars and I see it over and over again. Sometimes I would teach a weight loss seminar at UCLA and the 75-year-old woman post-menopause would lose more weight than the 19-year-old cook who's on his feet all day, and it doesn't make any sense because his metabolism should in theory be so much better and everything, but her mindset's in a stronger, greater place. So I don't want to make any promises for how much anyone's going to lose, because it really will come down to you and how motivated you are and how strong and positive your mindset can be and how well you track and how well you're water first, veggies most and do the program. But what we've seen in the test groups is about 10 pounds per month. So if it's 100 pounds, you should be able, with a strong mindset, you can totally and healthfully and steadily see that in a year or less. But it really will always come down to the amount of effort you're putting in, your starting point, and everything else. Kathy, you could totally lose 10 pounds a month is what we've been seeing. We're seeing someone lost 70 pounds in 8 months, someone lost that 80 pounds in 9 months, but it comes down to everyone's starting point and motivation. Jill is asking, how are you going to maintain your weight? Because she only has 5 pounds to lose. For maintenance, I recommend, once everyone hits their goal weight, I really recommend you keep tracking for at least 2 months after you hit your goal weight. You're going to be eating very similarly. The food plan works, but you'll track and you'll figure out how you maintain your weight best with the 2B mindset. So you'll still go on the scale and you'll see maybe that means that Monday to Friday I kind of stick to the program, and over the weekend I might have more room to treat, and I go on the scale Monday, goes up a pound, but then by Friday it's down a pound, and that's good maintenance for me. And some people might say, oh, well, I'm just gonna increase my workout and increase my what I put in my shake afterwards, and that will help you maintain. So maintenance is its own thing. I really recommend focus on weight loss mode now. When you hit your goal weight, it's awesome. I'll talk more about that and how to maintain your weight with the 2B mindset when I think more people are there. But I still recommend following the program and tracking, and then also using the scale and seeing how to best maintain your weight with this program. So you make sure that you do maintain that 5-pound loss. And you'll be so used to the habits of the program that it feels really natural to maintain. That's why we've had so many people not just lose weight, but have maintained their weight loss like so many months later. And I have really never had to talk to them too much about it, because they were tracking once they hit their goal weight, and they kind of figured out like how to best maintain their weight while going on the scale, making sure that they do. And I talk a little bit more about how to maintain your weight with the 2B mindset in the scale video, which is also a bonus video just for coaches, which is me and Lara talking about the scale within the Coach Office Success Group Guide.